Hi everyone, this is Dr. Sudeshna Ray. Welcome to the conference focusing on women, health, and digital. As the medical director of Gayatri.com and as the chair of the Femtech, it has been my endeavor to uplift the health of women through technology, through simplified delivery and accessibility, and talk about pressing issues that really bother women, and we need to focus on those pressing issues. So today, to join in our conference, we have in this panel we have a very eminent doctor, Dr. Abhishek Mangeshikar, who is an authority in a very dreadful disease of Indian women or women all over the world. Uh, that is called endometriosis. See, he is Dr. Abhishek is the head of Indian Center for Endometriosis, and has been working closely with endometriosis and giving us and is enriched with uh, the experience of handling endometriosis in various forms and in the most severe form. So we couldn't get a better person to talk about this very worrying disease for our conference today. So welcome, Dr. Abhishek. It's pleasant to have you on our conference.
Thank you, Dr. Sudeshna, for the lovely introduction, and I'm very honored to be here and happy to be a part of this platform. I think it's a great initiative, and many congratulations on your venture.
Thank you. Thank you, Abhishek. So I wanted to ask you about this endometriosis. If you can give a short idea of what it is and what is the exact burden of endometriosis that we are looking at.
So, that's a very important question because even among the medical community, there's no clear consensus on what endometriosis is. So, endometriosis is a disease where there is tissue that resembles the lining of the uterus. It's not the same thing as the endometrium, which exists outside the uterus. And it can affect not just the reproductive organs outside the uterus and the ovaries, it can also affect other organs like the bowel, that is the intestine, the bladder, the ureters, which are the tubes that join the kidney to the bladder. It can affect the kidneys, it can affect the appendix, the small intestine, the diaphragm, the lungs, muscle, skin, nerves, and even the brain. Um, it is primarily a disease that affects individuals who are born with female organs, but there have also been cases noted in men. It's not just a gynecological disease; it affects pretty much every organ system in the body. So there is a global movement towards treating this disease as a multidisciplinary disease. So there should be a multimodal approach to treating this disease. Now the disease works by it; these tissues that exist anywhere in the body undergo cyclical inflammatory changes which cause rupture of the capillaries around them, which causes inflammation, bleeding, and the formation of scar tissue and fibrosis. And then this acts like a nidus which attracts nerves and blood vessels towards it, which creates fibrotic lesions which are heavily vascularized and neuralized, which increases the sensitivity to pain as well. Upon when you describe the burden of endometriosis upon society, we have to look at a certain number of things in terms of healthcare costs and lost productivity. So there was a study that showed that the burden of endometriosis in the US causes a loss of productivity economically about to the tune of 70 billion with a B dollars per year. So there is a very significant amount
Hmm.
of time productivity lost. Then there the healthcare costs can require multiple medical interventions, including surgery. Patients are put on hormone therapies for a long time, and pain management. And depending on which country you're in, these treatments can be very expensive, and the cost can be a burden on the healthcare system as well as the individual patients. And lost productivity, because it can cause such significant pain and other symptoms that can interfere with the person's ability to work, attend school, carry out daily activities. This can result in lost productivity and missed work or school days. then it can have impact on relationships, can impact a person's ability to have a sexual relationship because of the pain associated sometimes, and this can also affect fertility, so there can be strain on relationships. Not to mention the emotional and psychological impact of this on the individual
Yeah,
and their partners.
yeah.
Yeah,
If we can come back to that impact on the individual, to the society, you're saying that it's a huge
yeah.
burden,
You know,
uh,
one of the
especially on
biggest
the
things is,
economic front.
yeah, how long it takes to get a diagnosis. So the average rate of diagnosis
Yeah,
from
that's
onset to
exactly my
symptoms is about 7 to 10 years. Yeah.
that's exactly my next question comes, that uh, it is so impactful and a disease, and it has so much of burden on the society, yet uh, we have seen endometriosis so high in incidence, even amongst the Indian women. But why is it that they come to us so late? Why is it that they are detected so late?
Yeah, that is a very good question. That is the, I think that is the key global question that has been plaguing everyone. So it's a very difficult condition to diagnose. So one, there are a couple of things. It's a multifactorial. It's a complex answer. It's not a very straightforward, easy answer. So we know that there is lack of awareness, not just in India but globally, not and not necessarily among individuals, but also among the medical community. Uh, so this can lead to delays in seeking medical help or even misdiagnoses. Then in our country also there is a stigma around menstruation. It's very difficult to have the conversation about menstrual health and menstrual hygiene, and it's still considered taboo in many parts of our country. Uh, Individuals may be hesitant to talk about their menstrual problems or seek medical help for fear of social stigma. There's a lot of gaslighting in the familial and in the medical community about pain associated with menstruation. A lot of young women are told that pain is normal, or they are just
Yes,
being a baby and over dramatizing the situation. We know that there's a lack of
yes,
access to healthcare in the country. Not everyone has access to the kind of hospitals we have in Mumbai, or the teams that exist and the super specializations and the big hospitals with the advanced laparoscopic and robotic systems that we have at our facilities. There's also a
yeah,
lack of specialist doctors. Like I said, this is not a advanced disease, is something that is beyond the scope of routine gynecology, and there is a call for a certain subspecialty in endometriosis as itself. It's a disease that is more difficult to treat than cancer surgery, but many gynecologists will always refer cancer patients out, but they will be very hesitant to refer endometriosis patients out to specialized care. But slowly there is a growing awareness coming, and this is happening. Also, there may
right.
be cultural and linguistic barriers in our country, and uh, women who don't speak the dominant language in their region may fail to communicate with their doctors and receive adequate care. And of course, one of the biggest hindrances of the delayed diagnosis is that there is limited research. We don't have well studied research papers. We don't have There's a lack of research on the condition. There is not much money put into this kind of research, so there's a paucity of information available regarding this.
So there's a lack of awareness, there's a lack of expertise, and there is a lot of prejudices that you're talking about, which prevents the early detection of the disease. So here we come, like digital platforms like Gayatri. Uh, how can they be of help in detecting them as as a part of the primary healthcare system? Do you think they will,
In
by
Yeah.
spreading more awareness, or by you know by being accessible,
Okay. Yes, I
the
think that.
technology of digital availability of information in the internet, or the digitalization of the women's healthcare, how will it, uh, in your
Right.
experience, do you think it will help um, in detecting
Yes.
them early?
Yes, I'm a firm believer in the these platforms, and femtech is a great movement, especially among for gynecological practices. So
Right.
the main thing is being able to provide very well balanced, accurate, and easy to consume information for individuals seeking knowledge regarding certain conditions. So
Mm-hmm.
education and awareness is key. We as primary healthcare providers can educate patients about signs and symptoms of endometriosis, which who need to seek help and medical attention earlier if they suspect they may have a condition. So that should shorten the delay in the diagnosis. Then we can have screening. They can ask particular questions about menstrual symptoms, history during routine examination, which can help identify patients who may be at a higher risk for endometriosis. Referral to specialists, primary healthcare providers and digital platforms can do due diligence and identify specialists.
Yep.
There are many that have identified vetted specialists across the world. I'm on these boards, so I am privy to this knowledge and information.
Yes.
Then we also can have prevention, but while there is no known way to prevent endometriosis, primary healthcare providers can advise women on healthy lifestyle behaviors, such as monitoring a healthy weight, exercising regularly, reducing alcohol consumption, some nutritional ideas, just to reduce inflammation in general, which can lessen the symptoms of the disease. It may not prevent the disease, but it may reduce the severity to an extent. And of
Yeah.
course,
So
pain
it can
management.
modify. It can modify the course of the disease, like the aggression that the disease presents to us with. Like by the time we see them, it's all very advanced. So it definitely can, early detection can modify the course of the treatment, the course of the disease. And the earlier the definitive treatment is given, I believe that we are heading for lesser complications, right?
Yes, exactly. I agree.
Yes. Okay. So coming, when you have spoken about this, I know that it's not a disease that can be prevented as such, but how do we lessen uh, the pain of the patient, and how do we complement the definitive therapy of endometriosis with other lifestyle things? So how much do you think the nutrition or lifestyle measures or immunity factors are responsible in kind of treating the disease in a holistic approach?
That's a great question. So, I was just in Harvard last week and we were discussing the role of immunological mediation in endometriosis. And there was a very interesting discussion that happened. And so, we know that there is some evidence to suggest that there are immunological factors and also some nutritional factors which may be linked to inflammation as well. One is there is immune dysfunction. So there's studies that have shown that women with endometriosis may have immune dysfunction, including changes in the levels of certain immune cells and inflammatory cytokines. This dysfunction may contribute in the development and progression of the disease. Second is oxidative stress, which is an imbalance between the production of reactive oxygen species and the body's ability to neutralize them, which has been linked to endometriosis as well. So we have oxidative stress that can lead to inflammation and tissue damage, which can lead to the repair, the injury and repair, which can cause fibrosis. And we also know that nutritional factors, such as a diet high in red meat and low in fruits and vegetables, may be increased with the associated inflammation and an increased risk of progression of the disease. Other studies have also suggested that certain omega 3 fatty acids and antioxidants may help prevent or slow down the progression of the disease. Then we also have some papers showing about environmental toxins, such as
Hmm.
dioxins and PCBs, which have been linked to an increased risk of endometriosis. These toxins can disrupt the immune system and contribute to the progression of the disease. So I think addressing these immunological and nutritional factors may involve a variety of interventions such as dietary changes, supplementation, and reducing exposure to environmental toxins. But we need much more research in these areas to fully understand the role and the impact of these factors on how the disease develops and progresses.
Yeah, but then they can definitely help in sort of as a complementary, as an adjunct to the definitive treatment, because
Exactly.
I think not as a primary treatment, but when they are, when we are giving them a definitive treatment, I think if it is associated or if it is complemented by the kind of a diet or lifestyle modifications that we want to have them, uh, the overall feel good factor or the overall outcome is
Yeah.
favorable,
Yeah.
right? You agree with that?
Yeah, that's very well said. Because we know that as of right now, unfortunately, the only main treatment we have is surgical excision of the disease. Medical treatments are more towards suppression of symptoms, but there is no evidence showing that medication, whatever you give, is going to reduce the quantum of the disease within the body. The only way is to surgically remove the disease. But even then, not all surgeries are equal, and what one person may do as a surgery can be very, very widely different from what the experts will do at surgery. So there is a need for standardization of surgical procedures, and of course, like I always say, the need for specialized centers. Now, our center is not just about the surgical aspect of it; it's about the multimodal approach, like we stressed upon, as in having a team in place to deal with the auxiliary and adjunctive therapies as well.
Right. Okay. So now, when we talk about these pressing, not only endometriosis, you have seen that with especially with women and the menstrual issues that we are talking about, the prejudices uh, that we can't, women can't talk about them, leave alone, give a lot of you know emphasis on the pain part of the menstruation, which is always considered to be a very normal and a common part of being a menstruating woman. Do you think how much do you think it has an influence on her psychological well-being, on her mental health,
So, I mean,
the
to answer
impact
the
it
first
has?
part of the question, there are huge prejudices for women in healthcare in general. There is obviously dismissal of pain. Women in pain are not taken as seriously as men in pain, and that's a fact. There is a very interesting paper called the Gender Pain Gap that addresses this. Uh, this can lead
Yes.
to delays in diagnosis and treatments of endometriosis, as many women are not believed or told that their pain is normal. And as we know, endometriosis is often misdiagnosed as many other conditions like IBS or PID, which can lead to delays in diagnosis and treatments. And then there's lack of research and funding, which we talked upon, lack of awareness, cultural belief. Some cultures regarding menstruation and health that have taboos, so those are not spoken about. And those are the basic prejudices. What was the second part of your
Yeah,
question?
this is
Sorry.
a very interesting statement that you gave, that the pain in women and pain in men are not taken
Yeah.
equally. That's I think forms the basis of uh, the kind of suffering that over the decades women have. Yeah,
Yes.
please go ahead about the impact, psychological impact, or the mental impact that the disease has.
Even our in our healthcare system in India, if you look at women's healthcare, especially from what the government or private insurances will provide, the only possible, they will try to link everything to, uh, they will not cover insurance for anything that is theoretically linked to fertility. So by any argument's sake, any procedure that is not a hysterectomy or removal of the uterus can be termed as a fertility enhancing procedure, which is absolutely a terrible way to look at a women's health in our country, because
Yeah, so
you're
getting them
basically
down to only baby producing machines, and
exactly.
health of a woman is equal to fertility. Once the fertility is done or once the fertility is not in question, it's not important for them. Yeah.
Yes, exactly. That is a huge issue which I have very strong feelings about, uh, especially since these conditions cause debilitation and pain in more than 90% of patients, and leading to severe loss of quality of life, as and only about 30 to 40% of these patients will suffer from infertility. So you're basically denying a lot of patients uh, coverage for a condition that is causing pain in 9 out of 10, uh, trying to accommodate for 3 or out of 10 that may have fertility issues as well, which is not uh, a logical way to approach this in general.
Right. So yes, so psychological impact that we are talking about. Um,
Mm.
how much do you think uh, when you see a patient out of about 50 patients, how much do you think, how many of them will benefit with a counseling, with a little mental, you know, talking through?
Yes, I think thankfully there's a lot of growing awareness about mental health, and at least in the city, our city, the of Mumbai, the conversations are happening. I'm not sure about the rest of the country.
It's
Still,
not happening.
there is some stigma associated with mental health, and not many people will seek that. And the problem with endometriosis is it can have a significant impact on mental health. Now, you imagine a patient who has been going to and seeing her OBGYN since her teens and has been told that there's nothing wrong with her because obviously in an adolescent they're not going to do any kind of invasive testing like a transvaginal ultrasound. So most of the ultrasounds will be abdominal if they get it at all, or if they're not just given painkillers.
And they will be
Uh,
suboptimal.
and yes, they will miss more than 90% of the disease. So teenagers are the biggest ones to suffer in this group. And then uh, I think I see a lot of gynecologists denying patients treatment for pain. They will only try to do surgery in cases of in cases of those seeking fertility. So I mean that is kind of misogynistic. Again, coming back to your very good analogy of women are just vessels for babies. Um, so to optimize that, mental health is a big thing to talk about. Endometriosis related pain itself can lead to depression, anxiety, other mental health issues. These patients may experience social isolation, reduce quality of life, decrease work productivity, so they feel useless and really low on themselves. I think the shortcomings in care, like I said, they're often treated by gynecologists, but a multidisciplinary approach is necessary to address the complex nature of this disease. For example,
Right.
women with endometriosis may benefit from pain management, mental health, nutritionists, sex therapists, occupational therapists, physiotherapists. However, access to these types of providers may be limited in smaller settings, and there may be a lack of communication and coordination between the different providers. Also, when you have a delayed diagnosis and treatment, these women are gaslit and may experience huge delays in diagnosis and treatment, which can exacerbate pain, anxiety, and mental health status. There can be also a stigma where they are associating mental health and pain, menstrual health and pain, which can lead to a lack of understanding and empathy for women with endometriosis. Uh,
Hmm.
Overall, I think addressing the associations between endometriosis related pain and mental health, as well as the shortcomings in providing multidisciplinary care, will increase awareness, funding, and collaboration among healthcare providers and other stakeholders in the healthcare process, and also improving access to healthcare and reducing the stigma and having these conversations like we're having today, and with platforms like Gayatri, which should uh, you know work to improve outcomes for women with endometriosis.
Yeah. Yeah. And as you were talking about the productivity loss of women in the,
Mhm.
we have seen that uh, most of the working women are dropping out because of the health issues, and especially the menstrual health issues. So how do you think, what is your view on improving or preventing that kind of a dropout from work? uh,
Yeah. So that's a very important question. And I'm very glad you asked that. I've been seeing a lot of and privy to a lot of these conversations in the West with the endometriosis groups that I work with. So there are
mhm,
several ways in which the workforce can accommodate. for menstrual health and provide support for individuals suffering from endometriosis related symptoms. One is they can have something like flexible work arrangements where employers can offer work from home, telecommuting, flexible schedules, and the ability to take breaks as needed. This can help employees manage their pain and fatigue and may also improve their work productivity. And paid sick leave, these can offer paid sick leave for employees with endometriosis related symptoms. This can help alleviate a lot of the financial stress and burden on these employees and enable them to take time off without fear of losing their job or income to get the proper treatments. Accommodations, then three is accommodations in the workplace where they can provide accommodations such as ergonomic chairs, heating pads, access to private restrooms, and to help employees manage their pain and their symptoms. Um, Also, education and awareness in the workforce. Employers can provide education about menstrual health and endometriosis to help reduce the stigma and increase
Yes.
understanding among co-workers and managers so they're not shamed. This can create a more supportive and empathetic workplace culture. Also, then in some places in the US, they have employee assistance programs that provide access to mental health counseling, financial counseling, and other support services for employees with endometriosis related symptoms. And then I think they can also provide inclusive health benefits if it's that kind of corporation where they ensure that their health benefits cover the diagnosis, treatment, and management of endometriosis related symptoms, including medication, surgeries, and mental health counseling.
Yeah.
Overall, accommodating for menstrual health and providing support for individuals with endometriosis related symptoms can help reduce absenteeism, it'll increase productivity, and it'll create a more inclusive and supportive workplace culture.
Yes. That's a fantastic input because I think, as you said rightly, that the awareness and the more normalization of the menstrual pain, though normalization, I mean acceptance that this is an issue, that menstrual pain cannot be just taken as something which the women are feigning or the women are, uh, you know, stigmatized with. But to understand this is for real and it needs an address and it needs cooperation from the society, from the workplace, from the family, from the medical fraternity, from um, the entire healthcare system. I think this is a great input that we uh, get from you. And last but not the least, Abhishek, what is your idea of a technology help? Do you think of anything which can um, help, any device or any kind of a technological support which can help to, uh, it has, I mean, we have fantastic systems to operate now technologically, but other than that also, how do you think technology can help in uh, reducing the burden of the disease?
Yeah, I really like this question. I'm not going to talk about it from the surgical perspective because we all know that surgery has evolved. We started, I mean, not me, but my previous generation started laparoscopy looking through a camera and nobody else could see what was going on. And then when I started, laparoscopy was on a big 55-inch monitor with a 4K system and a 3D system, and we had great technology available then. And then the robots came in, which gave us even better views and dexterity to perform these complex procedures. So forget about the surgical aspect of it. Let's talk about how technology in general has helped. So it's, we have access to healthcare services, we have telemedicine, we have enabled women to access healthcare services from remote locations, reducing the need for travel and increasing access to specialists. So telemedicine can help reduce wait times and improve patient satisfaction. I have a huge cohort of patients that I see from outside the city and outside the country who I can diagnose them remotely by reviewing their cases and their imaging myself and giving them a diagnosis and directing them to the appropriate care. So apart from telemedicine, we also have, there are not just for endometriosis, but tech in general. We have wearable devices like smartwatches, fitness trackers, which can help women monitor their menstrual cycles, track fertility, manage some symptoms. There are endometriosis apps that help patients reach a diagnosis or monitor their condition. We have then the third is personalized medicine. So advances in genomics and other forms of personalized medication, which have helped healthcare providers tailor treatment plans to an individual's unique genetic makeup and characteristics. This can help improve treatment outcomes and reduce side effects in a particular way. Also, we have great femtech as well as technology in general for patient
Yeah.
education and engagement. You have mobile apps, you have digital tools, you have YouTube, you have various health platforms on every possible medium you can imagine that can help patients better understand their health conditions and treatment options. These tools can help women track their symptoms and communicate more effectively with their healthcare providers. And of course, AI is going to be used to analyze huge amounts of medical data. I personally work with some companies that study my work and are using AI to help kind of analyze that and reproduce that. um, it's going to make more accurate diagnosis and treatment decisions. We know the diagnosis is very difficult to make, and very few specialists can actually make the diagnosis for endometriosis that is comprehensive. So AI is
Right.
going to help kind of fill in those gaps. It can also be used to identify trends and patterns in individuals' health data, leading to better prevention and management of health conditions. And overall, I think technology is a great thing. It has a potential to significantly improve women's health by increasing access to services, enabling personalized medication, and enabling and enhancing patient education and engagement. As technology continues to evolve, it is more likely that we will see even more unique and innovative solutions that address the unique health needs of our women population.
Yeah. Yes. So it was a great discussion with you. I think, Dr. Abhishek, uh, we not only understood, like, make through this conference, through this panel, we are able to send the message to our viewers that how important is the disease burden, how important it is for the entire society to understand the seriousness of the disease and to work at a much larger scale to combat it uh, together, and how well it will help us to improve the productivity of the women and of course the nation as a whole. Thank you thank you very much, Dr. Abhishek, for giving us the time and talking uh, and sharing your experience and your knowledge with us. And we hope we get more and more inputs like from experts like you. And your
Thank you.
what
I've
was
been
your, what would be your message to our viewers regarding the digital and women digitalization of women's health? Where do you think uh, women should uh, what should the women follow in terms of digitalization? What should they do to make the best use of the digitalization of women's health, especially regarding endometriosis?
Nice. So first of all, thank you for having me. I enjoyed this. I thought the questions were very insightful and well thought out, and I really had to think and uh, come
Yeah,
up with hopefully.
it's not a different, it's different from your
Yeah,
subjects. We always, conferences, we
yeah,
are only talking about the medical aspect of
yeah.
endometriosis, but here we are talking about the social aspect of endometriosis
So I enjoyed the
more.
question, and I hope that I was able to provide some useful insight onto this, not
Of
just from the medical
course.
aspect, but from other these things. And I don't know. As a takeaway, my main thing is yes, like I said, I'm a huge fan of technology and what it offers to our patients on the digital platforms. The only side effect is that now you see, and to me, it's a big problem that a lot of celebrity social media gynecologists are, you just need an Instagram account to become an endometriosis expert, and they have teams to put out creatives and but not necessarily the training. So you end up seeing a lot of patients with incomplete surgeries that have ended up with these specialists. So my advice to anyone consuming social media is that do your due diligence. Ask your providers the right kind of questions to figure out expertise. It's yes, information is great. We have everything we probably need to know in our pocket on our smartphones. uh, but the other side of the coin is that we need to be a little diligent and kind of get vet our vet our healthcare providers, because it's a little bit of a dodgy scenario out there. So I've seen some big mishaps personally, in not only in India but globally. You see a lot of patients who have been misdiagnosed and mistreated, uh, although when they were gaslit, it said that I'm going to perform an excision, and it's not necessarily what happened.
Yeah.
So
Apart from that, I mean, I think let's not talk about the negative side of it. I think the best way that women can take help of digitalization of the women's health is to identify the credible platforms, identify
yeah,
credible experts, and identify their symptoms by, as I said, early detection,
yeah,
and use them to kind of modify the course of the disease in a favorable outcome.
of course.
Agree?
That's the way. I agree. So I mean, it's a good thing because it's very easily available. The it's generalized information that tries to cover and encompass everything, and that's why there's more regularized content coming out from very good channels that are well researched to hopefully be able to cover everybody so that nobody falls through the gaps. And I think this is a really good platform for individuals to kind of get information in a non-intimidating way. And if they feel the need that they need to find specialist care, they can make that way to their care. So I think it's a really good way moving forward, of course.
Thank you very much, Abhishek. Thanks a ton for your time, and
Thank you.
look forward to your insights in our future conferences also. Thank you.
I'll be very happy and honored to be there. Thank you for having me.